guys, how are you doing? I hope you are doing well and welcome to today's session of learning. So today I want us to discuss about in my previous topic we learned about birth defects. So today I want us to learn or I want to elaborate on two of those birth defects. I want us to learn what are they so that we can understand well. Okay, so we said we mentioned some of the birth defects, the common ones. So today I want us to learn about two that are called neurotube defects. Number one, we have anencephaly, and we have spina bifida. So I want to elaborate more on what is anencephaly and also spina bifida so that we can get to understand these defects. So anencephaly is when a baby's brain, the brain and some part of the scalp do not develop. Okay, so or we can say underdeveloped brain and the scalp. So the brain and the scalp, these organs develop in the first 1 month after conception. Okay, in the first month of pregnancy, between 23 to 32nd day of life. Okay, so immediately you conceive, between the 23rd and the 32nd day of conception, this is when the brain and the scalp develop. So you find that a baby who is born with anencephaly, its brain and the part of the scalp does not develop. Okay, so and you know, these babies, some are born while they are dead, others die a few hours or a few weeks or a few days after they are born. So because of absence of the major portion or a or a larger portion of the brain does not develop. Okay, and the scalp, so these babies do not survive. Okay, most of them are born while they are dead, others survive for a few hours, a few days to a few weeks, and then they die. Okay, so the cause of this anencephaly, I said in the previous discussion, is lack of folic acid. Okay, folic acid has been seen to be very important. It plays a big role. Okay, it plays a big role in the neurotube formation. So that's why ladies are advised that immediately you plan to conceive, even before you conceive, immediately you plan to conceive, you are required to start on your folic acid. Okay, it's recommended that all women attempting to conceive to take folic acid on a daily basis, because it reduces the risk of these neurotube defects, number one, anencephaly, and also spina bifida. Okay, and if you have ever had a previous case of giving birth to a baby with either anencephaly and spina bifida, you should tell your doctor, because there is a high risk that you might give birth again to a baby with this same defect. So you should tell your doctor so that he can know the dosage of folic acid that you should take daily. Okay, so who are these people who are at risk of giving birth to a baby with anencephaly? Number one, people taking anticonvulsants. Okay, anticonvulsants, these people who have maybe epilepsy, there are these drugs that they take called anticonvulsants. If you are a woman who is taking anticonvulsants and you are planning to conceive, please talk to your doctor so that he can know, because you lie on a group of people who need special care during pregnancy, so that you don't give birth to a baby with anencephaly. Also have people with diabetes. If you are a woman living with diabetes, make sure your blood sugars are, or your diabetes is well controlled during pregnancy, because it predisposes your baby to anencephaly. Okay, you are under a group of people who are at a risk of giving birth to a baby with anencephaly. It does not necessarily mean that if you have diabetes, you will give birth to a baby with anencephaly, but you are at a risk of giving birth to a baby with anencephaly. You also have, if you have had a baby with anencephaly previously, if you ever have given birth to a baby with anencephaly, then you have a risk of again having a baby with anencephaly. You also have genetic disorders. This is something that you can't control. You find that there is an issue with genetics, okay, and this one you can't control. We also have obesity. If you have had or if you've been watching my videos, you discover that obesity is a risk factor to so many, almost all the diseases, all the illnesses. Obesity is a risk factor. So can you learn to control your weight? Okay, learn to control your weight. If you are overweight, talk to your nutritionist. He will help you to know how you will lose some kgs, or you shed away some weight so that you stay healthy. We also have opioid use. These are medications, those like strong painkillers like morphine, and we also have tramadol, and we also have codeine. Using these medications can predispose your baby to spina bifida or anencephaly. So during pregnancy, when you visit the hospital, before the doctor prescribes any medications, please can you let your doctor know that you're pregnant, so that they don't prescribe some medications that are harmful to your baby. Okay, so all pregnant women should not be given tramadol, morphine, or codeine. Okay, so let your doctor know that you are pregnant, so that they don't prescribe some medications that are harmful to your baby. So what is the treatment for anencephaly? Unfortunately, there is no treatment for anencephaly. So but during pregnancy, you know, the body has a way of getting rid of let me just call it something like a foreign body. So you might get a miscarriage. There's a way a body can just do away with a baby who has a defect. So you might find that during pregnancy you might have a miscarriage, or if you don't have a miscarriage, you will end up getting a stillbirth, giving birth to a baby who is dead, or neonatal death. Okay, so what is the prevention? We have folic acid before conception and during pregnancy. We also have avoid opioids. These are those medications that I have told you. We have like tramadol. When you are pregnant, ensure you tell your doctor that you are pregnant so that he don't prescribe tramadol. We also have avoid saunas and hot tubs. This is also another point I learned, that when you are pregnant, you should not use hot tubs or saunas because those high temperatures can induce a miscarriage. Okay, during pregnancy, avoid using hot tubs and saunas because they can lead to miscarriage. Okay, we also have maintain a healthy weight, because we have said obesity is a risk factor of giving birth to a baby with anencephaly. So stay healthy and control your diabetes. Make sure your diabetes is well controlled, and this helps because when you have diabetes, your risk of giving birth to a baby with anencephaly is high. Make sure you visit your doctor. Make sure you you go for all your clinics, and ensure your blood sugar level is well controlled. Okay, that is for anencephaly. Another birth defect number 2, called spina bifida, also a neurotube defect, is a birth defect developing that the spinal cord of a baby fails to develop properly. Okay, the spinal cord fails to develop properly. So what happens is the membranes of the spinal cord and the spinal nerves push, okay, through an opening, forming a sac on a baby's back. Okay, this makes the baby prone to life-threatening infections. Okay, because you see, these membranes, when it bulges to the outside, it might break. You see, and this, the spinal cord. Inside the spinal cord, there's a fluid called a CSF. It lands throughout your back, throughout the spinal cord to the brain, and so these membranes, in case they break, you see, then there's a risk of getting an infection, and if an infection sets in, it will travel all the way to your brain. So you will be exposed to life-threatening infections like meningitis, and these children should be followed by a specialist team of healthcare providers throughout their life. Okay, what is the risk factor of getting a baby with spina bifida? Folate deficiency. Okay, this is what we call folic acid. We also have family history, some medications like anticonvulsants. Okay, we also have diabetes, which is poorly controlled. We have obesity, and we also have increased body temperature like hot tubs and using saunas. So you see, the risk factors of getting anencephaly are more or less the same as the risk factors of getting a baby with the spina bifida. So what to do is take folic acid before and after conceiving. If you are taking anticonvulsants, if you have epilepsy, make sure you tell your doctor. Okay, you need a specialized kind of care during pregnancy. If you have diabetes, ensure it is well controlled. If you have obesity, work on your weight. If you use hot tubs and saunas, you have a risk of getting a baby with a spina bifida and also getting a miscarriage. Okay, some of the complications of this spina bifida, we have walking and mobility problems. These babies, most of the time, they end up being disabled completely and unable to walk. We have bowel and bladder problems because the nerves that supply the bladder, they don't work, okay? And we also have accumulation of a fluid in the brain. This is a condition called hydrocephalus. And I have mentioned meningitis, okay? So these two conditions are called neurotube defects. The most important thing you can do to avoid getting a baby with these defects is by taking your folic acid. That is the number one takeaway point. Make sure before conception and after conception you use your folic acid throughout your pregnancy up to the time you give birth. Why are you advised to take folic acid before conceiving? Because these defects occur in the first month of pregnancy, between the 23rd and the 32nd day of pregnancy. So you see, the earlier you start taking folic acid, the better, okay? The earlier, the better. Because now if you take folic acid before conceiving, by the time you conceive, your body will have enough folate, and even after you conceive, now your baby will get a good environment, and the neurotube formation will be well, because your body will have enough folic acid that is needed, or that is most important during the formation of the neurotube, okay? So that is it for the two birth defects, anencephaly and spina bifida. In my next session of when we will be discussing, we will talk about Down syndrome, a very, very common condition, so that we can know what is the cause of Down syndrome and what can be done to help prevent the giving birth to babies with Down syndrome. Thank you so much for watching. Remember to subscribe, share, like, and see you in the next session of learning.